As a preliminary matter, this is Don Holgate, Chair of the Nantucket Select Board. Permit me to confirm that all members in person on the agenda are present and can hear me. I'll go through the members first. Jason Bridges.
Hi, Don. Here.
Melissa Murphy.
Present.
Christy Ferrantella.
Here.
Matt Fee.
Here.
Great. And now I'll go through the town staff members that are present. Amy Baxter. Erica Mooney.
Present.
Ken Bogrand.
Here.
Libby Gibson.
In attendance.
Janet Schulte.
Present.
Tom Rafter from the airport.
Here.
Roberto Santa Maria.
Here.
And then we have some other guests joining us tonight. Tom Desmond.
Yes, I'm here. Here.
Gary Shaw. I saw you speak, but you're muted. Martha Turk.
Here.
Okay, that is everyone who is currently present. This open meeting of the Select Board, as well as the County Commissioners, is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of COVID-19, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the Governor's order suspends the requirements of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with the agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment through the Zoom webinar, where you do have to sign in with your name, and you'll have to raise your hand to speak. All of our meeting materials are posted on the town website, and you're encouraged to follow along. Our meeting is being recorded, and all attendees are participating by a video conference. And anything that you when you share your screen, anything that you broadcast could be captured by the recording. Please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly so that we can generate accurate minutes. Please wait for the chair to yield the floor to you. All votes this evening will be taken by roll call. And I believe that that's it. I will turn it over to Christy Ferrantella to call the County Commissioners to order.
Thank you, Dawn. So I'm going to call to order the County Commissioners meeting of September 16th, 2020. The first item on our agenda is announcements, and the County Commission meeting is being audio and video recorded. And next up, we have public comment for anybody who would like to speak for the County Commissioners for anything not already on the agenda. I don't see any hands raised. There's no new business. So the next item on the agenda is approval of minutes and warrants. And we have to approve. Okay, Melissa approved. Is there a second?
Second.
Okay, all those by roll call. Melissa Murphy.
Aye.
Don Holgate.
Aye.
Matt Fee.
Aye.
Jason Bridges.
Aye.
Christy Ferrantella, aye. And that was for both the minutes and the payroll. The next item on the agenda is official business. Winthrop Nantucket Realty Trust request for approval of withdrawal of Lot C. I'm going to turn this over to Ken.
Good afternoon, Madam Chair. Winthrop has filed a request with the land court, a petition to withdraw this parcel from registration in the land court and move it into the registry system. The reason for this is to be able to subdivide this parcel from the Stop and Shop. This parcel is known as sort of the tank farm. What is involved here is that the land court has asked that we assent to this petition because of the fact that there's a small parcel called Lot C, which abuts Salem Street, which we have a right to use, that we don't have any equity interest in it, but the land court felt it was appropriate for us to assent to the withdrawal. Winthrop is going through withdrawal of a number of these lots in this area, but this petition is only with respect to this one particular small lot that is Lot C next to Salem Street. Town Council has reviewed this and found that there is no problem with respect to this. It affects no rights with respect to the town's rights to use Salem Street or any other matters. And as a result, after review with Town Council, it is my recommendation that a motion be made to approve this assent in the form of the approved by the land court, which petition is being filed by Winthrop Nantucket 3 Realty Trust. I'd be happy to answer any questions relative to this fairly straightforward transaction.
Thank you, Ken. Matt?
Ken, is this necessary because they're merging it with another lot and they have different, and they need to be the same in the land court? What's the rationale on this?
Well, what happens, Matt, is that when you're doing stuff with the land court, whenever you change any dimensions relative to a lot, you have to file a brand new plot plan and go through the whole process with the land court. Whereas when you're doing it with the registry, it's a much simpler process than with the land court. So this is part of the work that they're doing relative to the reconfiguration of the land in the Harbor Square area. So they need to get an assent from the land court in order to be able to do that. And the land court, the lawyers have determined that the assent from us is really not required, but the land court said that they want us to be able to assent to it, simply to make sure that there's no problem with respect to clear title in the future. So it's a fairly straightforward transaction, and it's part of what they're doing relative to the reconfiguration of the properties that they own in the Harbor Square area.
Matt?
Yeah, another document in our packet was 1970 takings of all those streets. Have we researched, have we followed through and taken all of the stuff we've meant to take? Has that all been done properly? And we going to have any issues with that in the future?
I did not look into that question. I was not aware that was an issue. So I do not have an answer to your question.
Libby?
I believe the answer to the question is yes. All of those takings have been completed. We will firm that up tomorrow, Matt, but I am pretty sure that after like a 20-year long process to get all that cleaned up, it finally did get cleaned up, but we will confirm.
Yeah, thank you. That's my recollection too. It tweaked my memory, and I want to make sure that we're not doing something and being a good guy and then finding out that we didn't follow through and we're arguing about stuff that we should have taken 20 years ago. But I agree with you, Libby. I think it has been cleared up, but let's double check.
Jason?
If there's no downside to this and it's been reviewed multiple times by town council, I motion to approve.
Second.
All those in favor by roll call. Dawn Holgate? Oh.
Sorry, you have a specific motion in your packet that you have to read verbatim.
Oh, I don't have
I
that.
can read it to you if you want. It says move that we approved and execute the assent to the withdrawal from registration of Lot C, Salem Street, Nantucket, as shown on Land Court Plan number 8580A for case number 19SBQ 058000800 in a form as approved by the Land Court and which is to be filed by the petitioner Winthrop Nantucket 3 Realty Trust with the Land Court.
I'm happy to
Is
make
that
that.
your motion, Jason?
That's my motion, if that's okay with Erica.
Second.
Okay, and that was seconded by Matt. So I'll start with Don Holgate. Melissa Murphy.
Aye.
Matt Fee.
Aye.
Jason Bridges.
Aye.
And Christy Ferrantella, aye. That passes unanimously. And that, I believe, wraps up our agenda. Do we have a motion to adjourn?
So
So
moved.
moved.
By roll call, Don Holgate. Melissa Murphy.
Aye.
Matt Fee.
Aye.
Jason Bridges.
Aye.
And Christy Ferrantella, aye. I'll pass that back over to you, Don.
Thank you, Christy. I'll call the September 16th Select Board meeting to order at 5:12. I believe that we have one change to our agenda, and that we are going to move the fourth quarter end of year budget reports over to, is it next week, Living, when we're doing the projections for 2022?
Yep, the 23rd.
So we'll be taking item 2 under the town manager's report off of tonight's agenda. And I don't believe that there are any other changes or additions. I'll go to Libby Gibson for the announcements.
Thank you, Madam Chair. So we have this meeting has been being video and audio recorded. And we have our weekly census update, which I believe Martha is on. Martha, hi. She's got a quick update.
Hi, everybody. Unfortunately, we are not able to access current information about the percentage of households that have been counted today, either by self-response or by census takers. And it's frustrating because we all want to know where we're at, but it's just not available to us. We're kind of operating in the dark, but we're definitely operating with the knowledge that our complete count goal is still beyond where we're at. And so we're actively continuing to promote the census with a variety of things that some of you may have seen. We have geofenced ads on some Comcast stations. We have radio spots. We're in digital media and print and on social media. I recently recorded a couple of Q&A sessions with community members that are on NCTV's YouTube channel. They're subtitled in Spanish and Portuguese. And there's also a short tutorial video that walks viewers through the entire online form that's circulating on social media. Census Bureau staff were here on the island providing assistance last Saturday morning at the vehicle inspection station at Don Allen, helping customers waiting in line and others who had heard about the opportunity. It was very successful, and they'll be coming back both this coming Saturday morning and from 11 to 5 on Thursday, September 24th and Monday, September 28th as we approach the September 30 deadline. And finally, just a quick update about this Saturday's planned family drop-in workshop at the Artists Association, co-sponsored by the Complete Count Committee. The workshop has been canceled due to an abundance of caution, but instead, do-it-yourself kits will be available at the Visual Arts Center from 10 to 12 for those who want to participate in this community art project. For inspiration, check out the sculptures that were made in the June workshop in the entry area at Stop and Shop. And that's it for me this week. Thank you all so much. If you have any questions, I'm happy to answer them.
Thank you, Martha, for all the work you're doing. Really
Thanks.
appreciate it.
Thanks.
Okay, thank you. Agree. Thank you, Martha. Martha's been totally available with any questions. She gets back to us very, very quickly. So thank you so much. Next, we do have a committee appointment coming up for a vacant HDC associate seat, and we're advertising it as an announcement, sort of advertising it as an announcement on the agenda so that people can understand when we're filling it and what the deadline for applications is, which is this Friday at noon, and the appointment will be made next week.
We currently have 2 applicants.
Sorry, thank you very much. Yes, and they'll be in the packet for next week. Yeah, their applications.
And they're in this week too.
And thank you. Okay, then we added an announcement because I forgot to put it on the agenda earlier. We have 2 forums coming up on Friday, resiliency related. It is called Resilient Nantucket Forum number 1, Preparing Your Historic Property for a Future of Rising Seas. There are 2 of these. They are this Friday, the 18th. One is at 11:30, one is at 6 p.m. They are both via Zoom webinar. If people are interested in attending, you can simply join online. I believe there is information online about it, and there's a Zoom link. You can also email Holly Backus, our preservation planner, who can help get you registered, hbackus@nantucket-ma.gov, and there is a flyer on the town website about this. That is it, I believe.
Thank you very much. We'll move on to our COVID-19 weekly update. Are there any opening comments or questions from the board? Okay, seeing none, I will move to Roberto Santa Maria or to Gary Shaw. Who would like to?
Gary, so that we're not wasting his time.
Gary, would you like to open?
Oh, sure. Be happy to. Thank you, Dawn. Well, thank you for the opportunity to come before the board again and to give an update. And thank you to Nantucket for being out there and doing such good work to still help us go in the right direction with COVID. Although we are still seeing COVID numbers today, we saw an additional 6. We aren't seeing a spike that is going exponentially higher, but of course, anything that's more than 0 is concerning to us, and I know lots are doing work to mitigate this. We have seen some huge lines, as many in the community know, out in our portico at the drive-through for 2 reasons. One is that we started our annual flu vaccine protocol and heavily advertised that and set up an extra 3rd drive-through for that. And with the COVID testing that we do and the CastNet testing that we do, which is voluntary through scheduling on the town or the hospital's website, we've seen, in essence, in the last few days, probably over 400 vehicles coming through, as well as people walking. And today, not so much. We saw about 95 total tests today, and much down from over 200 over the last couple of days. Many of those are flu coming in for vaccines. So glad to see that everyone's getting their flu vaccines. I will say that from a communications standpoint, and maybe Roberta will touch on this today, we want to get as much information out as rapidly as possible to the community related to precautions and things to consider as you're navigating this world that we have with COVID in it. I will say that I am extremely pleased, and as the town is and the public health department is, with the work that our retail merchants have done downtown, our hotels, to keep things safe. And we are not seeing clusters in those areas. And I would say that I encourage you to still, go out and mask appropriately, socially distance, enjoy a meal, and be able to enjoy an evening with your family. We believe that there has been terrific work done through Roberto's leadership and the town's leadership in allowing things to occur on streets and other areas where you should be safe. But of course, masking, if you're moving through crowds and things, is always appropriate. I've been doing radio announcements at 8:45 with ACK. They're also posted on islandtrueradio.com if you'd like to go listen to them. And it's focused on giving as much information as timely as possible to what's happening. So please go out there and take a look. We're also translating those into multiple languages. I am a little concerned and did talk about this today with the EOC about what appears to be some lack of cooperation or public shaming related to COVID or perceptions of where it is or where it's not. And what I would just say to the community is, we're all in this together. Doesn't matter where it is. We don't want it here. But I will say that, our Hispanic population, although affected, are doing great things to come forward and test, and they want to know what's happening and how to be safe and how to access care. And that's a fantastic thing. And so are our non-Hispanic community members as well. But the most concern right now is in contact tracing. And that when we contact trace, we're calling because it's a public safety issue. We're calling in all languages, in all ethnicities and all races on this island. If we find a contact, we'll find some way to try to reach that contact. But about 10% of the Caucasian residents are really not being very nice on the phone. And what I would ask is that share with your friends and neighbors that we all want to learn and be able to trace and help people that we know would need it to prevent the spread of this virus. And cooperation with the contact tracers is what we would truly like. It was interesting early in this whole evolution of COVID that I was hearing about this with the state's contact tracing program on the mainland and didn't experience that at the time here, but we are experiencing it now with about 10% of our calls. So please, we're here for you. You've come in for testing, you're concerned. We want to trace. So please give us the information that you can so that we can protect the health of others. It's so important. And work together as the Nantucketers that you are, an island that pulls together in tough times and helps us launch forward. Outside of that, Dawn, I don't have anything else other than what Roberto would want to add.
Thank you very much for being here tonight. I did just want to mention quickly before I go to you, Roberto, is that Beth Hallett will not be joining us tonight. We did have her at the EOC meeting earlier. Today was a successful first day of remote school, and we'll probably have her on in the coming weeks to give us updates. But it wasn't necessary for her to come tonight. And I think that in my own household, the kids did well today, and everyone is hopefully settling into their new schedule. Roberto?
Yes, so let me quickly join. Here we go. So for today's report, it's almost exactly the same as what I gave on Monday. Today's numbers are not included in today's numbers are included in some of the calculations, but they're not included in the graphs. So that's important to go, and I'll have that updated by the end of today so that we can use it for the Board of Health tomorrow. So real quick, today, as of today in the morning, we had 8,219 tests done, 2,800 of which are from the CastNet. We're now seeing that, and as a result, we have those 34 cases in the last 10 days. And I just realized that my microphone was off. Can you hear me now? Okay.
We were able to hear you, Roberto. At least really? I was.
Good.
Yeah.
Good. Sorry. So it's just because my microphone has a red little blinking button when it's not working, and it was blinking red. So here we go. Back to the 2,800 that were done through the CastNet. So we've had 34 cases in the last 10 days is what we're going at. And as Gary mentioned, the contact tracing is in progress, and it is starting to become largely successful now. There's been a lot of response, and now that we've gotten a lot of information out to all the community members who are understanding what contact tracing is people are starting to respond better. So that's always pretty good. Still showing yellow on our positive test rate, and our contact tracing is getting a little strained. It is happening, and that's part of the work. So we just need to keep an eye on it. As far as our positive test rate, currently at 1.22% of the total, 101 out of 8,200, 3.49% of testing yesterday. And then there is 2.26% of our 7-day average. I did write 20 cases, so I might have miscalculated that. I think I forgot one day. I think I missed one day. So that 2.26% compared to the 4% that we had on Monday might actually be incorrect. So let me fix that before I post that for later, and it'll be correct for tomorrow's Board of Health meeting. As far as the death, thank God we still have only the one death, and we don't have anyone hospitalized at this moment. And then what we're also running into is that it is still less than 1% of, I don't know why it's highlighting weird, of all the testing. Everything seems to be doing pretty well. The sewer predictive index, unfortunately, we still haven't received this week's BioBot report, but once that is up, I'll be able to put that in. Hopefully we can get that tomorrow, and it'll be in the Board of Health meeting packet tomorrow. But as a result, you'll see the results in that last page. Same metrics that we're seeing. So with the age breakdown, over 50% of our cases now are below the age of 39 or 39 or below. And we're just seeing that same trend, even with today's new cases. Today's cases were all traced, and we all were able to find the point of exposure on it, which is really good. By finding the point of exposure, it kind of removes that risk of community spread. So we did have community spread in the initial point of this outbreak, but once we were able to identify all the cases, all subsequent cases after that, we were able to trace to an exposure, which is very good. That's incredibly important to understand, that the community spread only happened in that first beginning section of the outbreak. So continued with the race breakdown. It's the same race breakdown we had on Monday. All these will be updated by the end of tonight or tomorrow morning. Actually, give me till tomorrow morning. And then from there, point of origin is still the today's 6 cases and yesterday's cases all are from Nantucket. So you're going to see the 61% move up closer to about 65, maybe 67%. As I mentioned on Monday, the cumulative incidence of these is just an addition of all the cases we have been seeing. So what you're seeing in the last 10 days is what's highlighted in red. What you're going to see is now this spike is above this 100 line. As far as the sewer goes, you're going to be, the predictive index still had it going down. We're hoping that tomorrow, if we get the report by tomorrow morning, this section here will either be flat or lower. What we don't want to see is a spike going up, and that will decide any major policy decisions. So we'll keep everyone informed as much as possible. So I added this from last time because I mentioned the flattening of the curve, but I felt like I should reiterate where we were and what it meant. So we're getting a lot of, like Gary said, some anger, and some shaming that we're seeing. And COVID is not something that somebody should be angry about, somebody should be ashamed of. Nobody did anything wrong. That is really important to get here. What we're going to see cases. The only issue that we're looking to do is flatten this curve so that we can see the same amount of cases. Let's say Nantucket was going to get 4,000 cases. We'll still see those 4,000 cases, except over a longer period of time. What we're trying to see is that instead of having 300 of those cases happen in a 1-week period, those 300 cases happen over a 3-month period. That way, our hospital system can respond better. And we're hearing a lot of anger and stuff about masks, and the masks do work. It is a lot of misinformation out there about how masks don't work, or the CDC lied and said only 6%. I don't understand the world of science denial, which is really kind of interesting. And we're seeing a lot of it, even in some of our more educated population here on island too. You're seeing a lot of science denial and fear mongering, which is really kind of surprising. So we really have to get that message out, and we're doing what we can to get all the information on masks out. So real quick, where are we? This number is now going to pop back up, which will mess with this trend line here. Hopefully this trend line will still maintain it won't go up too much. If you remember from high school mathematics, for those of you watching at home and have kids in high school, this is where you can explain to them that everything you learn in algebra still happens in real life. Y equals mx plus b, yeah, that's this. That's your line there. So as we see new cases, that m, which is the slope of the curve, is going to start moving up. So that's going to, and b being the intercept, still starts moving up. So what we're hoping to see is to make that m, that slope of the line, either a negative number to go down, or you want that M to be 0 in order that means it's completely flat and going straight. And then we talked about the next steps, and we're going to be merging these two, step 1 and 2. We're going to be merging them so that we can continue, so we can step up enforcement. What we did have today, we saw a few people without masks inside their trucks. So what we're going to be doing is sending out more information out there. And this is the last warning. If we see any more people not wearing masks in their trucks, and that includes town staff, if we see people not paying attention, we need to lead by example. If they're in the work truck without masks with each other, we're going to be ticketing the business owner because it is their responsibility to make sure that their staff is in a healthy environment. And with that, I'm going to call it, and then I'll try to recognize Taylor if it's possible, so she can give us a brief update of where we are on the Human Services section, the outreach. Taylor?
Can you guys hear me?
Yes, we can.
So we're going to be pushing out a lot of direct outreach and messaging to the organizations that serve the populations that we're trying to reach. And then additionally, kind of Gary and Roberto both touched on this, together with the hospital social worker, Sarah Chetkowski. I'm working on a project in which we invite community members to share brief written or video feedback on something they have lost or the way their lives have changed significantly due to the pandemic, and then kind of bundle that together with strong messaging around the importance of showing kindness to our fellow Nantucket citizens. So I really look forward to sharing that with you all and with the community. So stay tuned for a lot more outreach and messaging. Thank you.
Thank you, Taylor. So that's really quickly it. I do have my good old visualization board, and I do want some people to ask questions so that I can use this whiteboard, because Suzanne gave me this board and I haven't been able to use it yet. So
question, Matt, then Kristen.
There we go. Yeah, perfect, Roberto. Maybe you can use it. Hang on. We got a couple questions from an individual this afternoon, Beth Berry. One of her questions was about timing of testing. If someone is, let me see, there's an incubation period. If people are running out right after they're exposed to get tests, does that make sense? Shouldn't they wait 2 to 5 days and then get tested and quarantined? Because it takes 2 to 5 days to 14 days after being exposed. So that was her question. Like, what if you could explain the timing of when the proper time to be tested after a potential exposure?
That's actually that is a great question. Thank you for bringing that up. What we're running into, I keep saying what we're running into. I don't know why. So what we're seeing is that people are hearing that they're getting exposed and they're running right out to get tested. And that's absolutely true. If you get tested within those first 48 hours after you got exposed, you're probably not going to show up positive, even if you did catch it. You want to go at least 48 to 72 hours at the minimum after you have been exposed. That 4-day period that you hear when people show symptoms between 4 and 14 days, you should be able, a PCR test should be able to pick up a positive test within those 24 hours before. So that's why that 48 to 72 hour window is still okay. Before you show symptoms, it will show a positive in a PCR test. But yes, you do not want to go and just test immediately after you've been exposed. You're not going to show up positive because it hasn't had enough time to infect the cells. So we could put out information there. And as soon as you hear you're exposed or when you were exposed, if you find out you were exposed 3 days earlier, then yes, go out and get tested immediately. But if somebody tells you, oh, I have COVID, don't run from that person and go straight to the testing. You're not going to come back positive. It's going to be a false positive possibly. Gary?
Yeah, thanks, Roberto. I just wanted to also emphasize that during that time that you're waiting for the virus to potentially incubate, you want to quarantine. It doesn't mean that you're out in the public. You want to go home and you want to stay there until you can actually be tested within an incubation period that allows enough viral load to be present for the test to pick it up, and then you'll know better.
Correct.
Thank you. Oh, Matt, do you have a follow-up before you go to someone else?
I do. I just want to. I told this Beth that I'd ask her questions. Her other one is, who is monitoring the travel paperwork from those arriving from other states that are supposed to show proof of 14-day quarantine or a negative 72-hour test? How is that monitored?
Yes, so the monitoring is done through the travel order form that gets sent into the state, and then the state uploads it to a SharePoint file that I have. So every day it gets uploaded, and we get to see that. Unfortunately, the way the governor's order is set and the way this sort of program got rolled out, the people self-report. And let's be honest, there's a self-selection bias there. If you're self-reporting, that means you're actually paying attention to the rules, which means you're more likely to have gotten a test or more likely to quarantine. So what we're seeing in those travel orders is the great majority already have a negative test, and they're uploading the proof of their negative test within those 48 hours before they travel. So we're seeing that, and it's something we can't really react on. But when they are saying we intend to quarantine, we are calling. We do have somebody who is calling them and making sure that they're at the address that they're saying, because we are requesting the phone number to be the landline of the location that they're being at.
Okay, thank you. Christy?
Thank you, Don. Roberto, just a couple things. So I know that this was mentioned also by Gary Shaw that, typically with COVID, we see kind of more of a doubling or exponential increase. So seeing this, it's kind of, I don't want to say a good trend, but we're more comfortable that we're being able to trace that. And so some of this panic can, we can feel a little bit better that we're taking the right steps and we have the right contact tracing. So just to ease a little bit of those fears, I think that's an important point. We still want to be vigilant. We still want to be wearing our masks. But if this was, true kind of community spread, and it would be in all these different industries and growing a little bit more exponentially.
Correct.
And I know that you probably just didn't update the slide, but it says trades enforcement. And I just think that all the enforcement and education, we discussed this on Monday, should be to all industries. Yes. As a reminder that we all need to stay ahead of this.
Yes, so I'm in the process, you're absolutely right. I'm in the process of writing a letter to employers that we're going to try to get out through the chamber, through NARAB, Lodging Association, the Fertilizer Association, Restaurant Association. We're going to try to get them out to as many as we can. So I was supposed to be able to get that out today, but I haven't been able to. But yes, absolutely. One good thing that you mentioned, and I'm actually going to be able to use this thing now, is actually what you mentioned was the exponential growth. So if you might remember when this was all starting, I discussed, and you can't see it, of course. Haha, there you go. The R number of COVID. The R of COVID was 2 in your average population. This is a terrible thing. Let's have some fun here. So if you might remember, the R was 2. So the way the R is for every one person that gets infected, they can infect 2 others. So what that would be is, day 1, day 2, and then 2 days later, 1, 3, 5. So on day 1, day 2, 2 more get sick, so that number would actually be 3, and then these 3 people get 2 other people sick. So on day 6, it would be these 4 plus 6, so you would see 10, and it would go like that. So what we're seeing actually is, as these numbers are going up, we're seeing, yes, the numbers are scary, and this is actually really wobbly for those of you watching at home. So for the numbers can seem scary. What you're seeing is 7 on one day, 7 on another day, 4, But what we're seeing is that this is a 1-to-1 transfer and sometimes less than one transfer. So for every one person that is sick, they're only infecting one other person. A lot of times that's just somebody that they're living with. So a 1-to-1 transfer is actually an R of 1, which is a flat curve. It's that M on that Y equals MX plus B section. But moving from 7 to 4, you see here, that is actually a negative drop. So that would actually be more over this 3-day period, you would see an R equal to, what would that be? Approximately 68, 0.68. And what you want is the R to be less than 1. If the R is less than 1, and that's my belly in the shot, what you see is R is less than 1, eventually that curve on a regular R plus R more than 1 is a curve like that. R less than 1 starts dropping. So that's where we are. And I know it's not the most eloquent way of showing it, but I've been dying to use this thing. So that's really what it's been.
Jason, then I'll go to Gary Shaw.
Thank you, Madam Chair, and thank you, Roberto, for that. That's kind of what Christy touched on. What I was going to ask is the importance of, like, we, as you said, we don't want any cases. If we have 6, we want them all to be traced, right? We want to know where they're coming from. And the scary part is if we had 6 cases and we don't know where they're coming from, or they're new. And so that's, I think, really thinking about having that R under 1, and you saying that the 6 cases we have today, we know where they were contacted from, is really important to have a little bit of light here. Doesn't mean we can take it easy, but I just wanted to make sure that if you explain that more if you need to, or maybe you just did with the R1.
Thank you, Jason. Gary?
Yeah, thank you, Dawn. Let me just point out a couple of things that would take us back to the beginning of this and maybe help frame up where we are. As Roberto talks about those R numbers, if we go all the way back to when we started locking the town down, I think it was in, what was it, April? I can't even remember the date now. We had very limited capacity to test, and we were rationing those tests for cases that were either first responders, or if somebody came in and tested in our drive-through with the volumes that we could test, we would ask them to go home and quarantine. And we were following those up with physicians, but we were not testing the entire family that was in a room. But we knew that other people at home got sick, and we assumed that some would escalate to be more severely ill, and that didn't happen, fortunately. But there were several households that most of the family members became ill, quarantined, and the virus burned itself out and it went away. By the fact that we've increased testing so exponentially, we have essentially cast a net out there to find everywhere that it could be. And so as the summer went on, we started to see that most of the cases were coming from day trippers and folks coming over on ferries didn't feel good, or because the governor actually put the order out to say mandatory testing. I want to get tested. Oh, I'm positive, but I'm only here for a week. I'm going to go home because I don't want to quarantine here and then get back on the ferry and leave. So we started seeing cases coming over through symptomatic and asymptomatic testing start to come positive. And that was the majority of what we saw in the summer. The population of this island, I've learned in my short time here, does not really intermingle. And so when you think about the testing that we put in place for the entire island and the populations that we saw surge over here into the summer with really limited cases amongst the population, we know that we had periods of 2 to 3 weeks where there were no cases at all. Well, that's indicative of there really wasn't any virus here at that time. So we were trying to do a serology study to help us understand the early prevalence of COVID. I had said very early on, behave as though it's here. It probably was, but we couldn't test for it and we wouldn't know until someone became ill. When we didn't do the serology study because the population exploded with travelers before we could get that study approved, we felt there was no value in spending those dollars on something that really wouldn't give us better information than PCR testing. We just ramped up the PCR testing. And so through constantly talking about it and advertising that it's out there, all of the ethnicities of the island have become comfortable to come in and test, which was not what we were seeing in the very onset of this. So I think now you're starting to see these ones, fives, sevens, fours, threes, fives, without a huge escalation occurring, simply because we're drawing in more people who are concerned and want to do the right thing and know. And so as long as we see that through our surveillance, that we're kind of bumping along still at the little bottom of the creek, it still is an outbreak. It still is a focused cluster, but it's with more of a focused group. Contact tracing appears to be working. And so I would say that, will we see a big spike? It depends on whether or not people are not really giving us their contact information when they've had an illness. And, if there's cross spread in the community, we'll find it, because we'll find other people that become ill. We contact trace them. They give us a name of a person that was ill previously, but didn't say anything about it. That's kind of how all of this adds up. So you start to build a picture from all the pieces of the puzzle, and you start to get excited because you can actually do something about it then. So by what we're seeing, I'm actually encouraged that we are able to manage through this. But I'll tell you that the testing protocol and having it available is so important, so we can find it and quickly isolate it. So I think that a good job is being done by all, and the behaviors are helping, and that people are concerned, and that's great for this community. So I just wanted to point that out. And Roberto, if you have anything to add on to that, appreciate it.
Yeah, no, absolutely. You've nailed it right on the head. And just a quick update. And one of the things that I love about Nantucket is just the diversity of the education and everything that's out here. So on a lot of these presentations, I usually have, people follow on the numbers and the science, and I get critiques, and I sometimes get corrections. So I want to say thank you to Kimberly Clark, who just responded to my numbers here, and the numbers that I had wrong, she actually just corrected for me. So I wanted to update everyone. The 7-day positivity rate that I had put up using the incorrect number from before. So the 7-day positivity rate is actually 3.7%. Using the 1,008 cases over the last 7 days, which came out to 38 new positives over the last 7 days. And that was as of about 4:20 today over the period of the last 7 days. So thank you, Kimberly, for fixing that. I really appreciate that. And I was able to get that information as much as possible. Thank you for your fast work. And I'll get that up corrected on the PowerPoint.
Melissa?
Thank you, Don. Thank you, Roberto and Gary. It's a really enlightening presentation, and it gives me great comfort. I wanted to ask about how, since our meeting on Monday, and perhaps Roberto and Libby, this is for you, just how our enforcement efforts have been going. And if you mentioned it earlier, I apologize. I may not have heard it thoroughly, but I know that we had supported your direction, Roberto, of enforcement and education over these past 3 to 4 days to really outreach into the community. How is that effort going, and how are we seeing the community respond?
So actually very, very well. Man, I don't have one in front of me. They're in the back here. So the hospital was able to provide us with some care packages, PPE packages, and we provided over 100 packages over to Carolina's Market, Salvadoreña Mini Mart, and the Trading Post. And all three of those business owners have also been very they want to be as helpful as possible. So that's been really great. And we have extra PPE packages here. Though some of these PPE packages have been delivered to all our positive patients, all the current active positive patients. And those packages are, they have information in them in multiple languages on how to protect yourself and how to protect the public. They have masks in them, and they have hand sanitizers in them. So it's really good outreach. And we've also provided some videos. We provided videos on all our social media and on the websites in English and Spanish. I did a video yesterday in English and Spanish, and that has already had more than 10,000 views. So it is reaching a large population, which we're really happy with. As far as the enforcement goes, since Monday, so a real quick comment on enforcement. We have been enforcing, and we have actually issued tickets over the course of the summer. We did issue fines to a few properties and businesses that weren't cooperating with the mask order, things like that. So we had been following up, and when the police see issues too, and they need to refer to us, we are getting their referrals, and we are all following up on all those referrals as well. So we've responded to multiple restaurants, and we've connected with a lot of the business owners on Main Street, for example, as those complaints and comments come in. One of the things that do come up is, so since Monday, that one of the things we do come up is we're getting referrals to us, people are calling or people are sending us emails after the fact. And it's really hard for us to respond after the fact. If we get an email today that says, on Monday, I saw this, well, then it's too late. All I can do is send them we heard this, just keep an eye on it. So that's one of the things we're seeing. We're seeing our email inbox flooded with people saying, on Monday, I saw this. On Saturday of last week, I saw this. As soon as you see it, if you can get it to us or get it to dispatch so that they can get it to us, that would be the best way. Yesterday, I responded to a complaint about a large wedding that was happening in Tom Nevers. I did go out and I checked it, and the wedding only had 25 people in it. The staff were only 10 people for the staff on the property, and there were only 3 musicians. And the wedding was outside. The rehearsal dinner was outside. The wedding is today, which I believe John is checking on today. The rehearsal dinner was outside, so that's below the 50-person limit, and all the staff were wearing masks. So it's really interesting that we're seeing that sometimes we get, for lack of a better word, a spite complaint, where it's a complaint that they want to, because they want to kind of jab a neighbor or jab somebody. And that is hard for us, because it does take person power to do that, to follow up on every one of these complaints, because we're following up on every single complaint. So as soon as you see the issue, if you can take a picture and just email it to the health@nantucket-ma.gov email address, things like that, we can follow up with that. We need that hard evidence. And if it is still ongoing and you call us, and if it's during work hours and you call us, if it's after work hours and you call dispatch and they can get a hold of one of us, we can get somebody out there immediately. And as soon as we get out there, we'll be responding. As we mentioned in some of the previous meetings, in July, I believe this was, the time for the education to the business owners and property owners and things like that, the time for education has come and gone. If you don't know that there's a pandemic out here, you have either been willfully ignorant or willfully negligent. So as soon as we see violations, we're issuing fines on.
May I elaborate just a tiny bit onto what Roberto said? The PLUS inspectors are out. The health inspectors are out. Mm-hmm. We do have our seasonal health inspector out, and we are advertising for, if we can, more bilingual COVID educators. We've had a little bit of interest potentially in that today, but when we advertised before for COVID educators, we did not get a big, gigantic response. So we're going to do our best, and that they're more for outreach, not necessarily enforcement, but they can report things. And we had talked earlier in the summer about giving the board a weekly enforcement report, which outlines, where the inspection personnel has been, what they did, if they issued tickets, things like that. So we need to resurrect that, I think. But as Roberto said, there has been enforcement throughout the summer, and we're working to keep it up now, but also concurrently educate and do outreach and communications.
Natural resources guys are all out there too.
Christy?
Just to follow up on Libby's comments, I would say personally, I don't want to create more work of having to report on enforcement to the board. I think it's just more important for that enforcement to be done. So I think, any tickets that were issued, that's something that could be reported to us. But I think trying to have all departments report in on where they've been and what they've checked, I think more of the focus could be on COVID and preventative measures.
I agree with Christy.
And we're remiss. Sorry, Amy has been out there doing a lot of work too.
Sorry, Amy. How could we possibly overlook that? Amy's been amazing.
Oh, sorry, that was a private text, Roberto. Thank you.
For the record, Amy texted me to tell me that she was also helping.
Thank you for disclosing that, Matt.
Yeah, we don't need to know every single, you don't need to know every single enforcement action, but a general report of, yes, we have X amount of people, they're out these hours on these days. This is what we're targeting for this reason. That's important. If you have a written enforcement plan, then you have metrics that you're, basing that upon, and then you adjust that depending what you need. And so both of those are needed. And I think the second part, it's great to have a report, but it doesn't have to be every single minute of the day. But just a general, here's what we plan to do, here's what we did do, and here's how it's working. That's how I view it. And I think that's important.
Can we move on to our next agenda item under COVID? We wanted to have another, Kristen, sorry.
Sorry, one last comment. Just, I know that tomorrow there's a Board of Health meeting, and I know that just seeing the increased cases, there's a lot of panic, and I don't know if the Board of Health is leaning towards any sort of closures or anything like that, but I would just have to say this, just for the record, that I would hope that if there are any closures, we have a plan of how to reopen, because we really struggled with that this past spring, of thinking we would maybe go into a shutdown for a week or two, and it was several months. And a lot of that fell on select board. And I want to urge the Board of Health to really think carefully about what the data is showing us and decisions that we make and how we plan to kind of climb out of a closure if they ever went in that direction. So thank you.
Yeah.
Chris, thank you for bringing that up. Oh, go ahead, Roberto.
Yeah, I think we were explicitly clear on that on Monday, that I'm recommending against any closure right now. We're not moving into the closure direction. We know a lot more about the virus than we did back in March. So like I said, when we were seeing the results of the cases that were showing up public, we didn't know about asymptomatic cases at the time. So what we were seeing was that 30% of the people showing up were getting in the hospital. That's what we were hearing. So we know a lot more about the virus now. We know a lot how to treat it better. So chances of a shutdown are way less. I know there's a lot of discussion, a lot of rumor mill. The Facebook rumor mill is more damaging than it is helpful. There is no discussions of a shutdown right now. At the very most, what we're looking to do, if we needed to, was limitations, but no shutdowns.
Thank you. Melissa?
Thank you, Christy, for that question. It actually reminds me of something that I have talked with Libby about, but I think is also, and I hate to give anyone one more thing to do, and I know we're not, quote unquote, out of the pandemic, but we are learning to live with the virus differently than we were 6 months ago. And I do think it would be really appropriate at some point for us to review, at least at the EOC, lessons learned, how we responded initially, where we hit the target correctly, things we could do differently next time. One concern I have, and I think this is somewhat the direction that Christy is going in with her comment, is that we have a long winter ahead of us, and we don't know what to expect with the pandemic and the virus. And I'd like to make sure that any lessons that you all have learned as a team and how we responded to the pandemic and the virus initially, how we would do it a second time. We now have a roadmap. It shouldn't be new. And we should have some sense of a plan in place for just in case things get worse. So thank you.
Gary Shaw?
Yeah, thank you, Dawn. To your point, Melissa, and very well said, I think what the data is showing us is that in all communities, we're unique and different, and we have to determine what our new norm has become based on our populations, what we've learned about moving into this, what we know about the infection and the disease, what we know about incubation time. Just because we have so much testing available now, I think that's the reason we're seeing cases that I think were always here, but we didn't know it because we couldn't get the people to come in or didn't have the testing resources. So maybe it is, every couple of days a 5 or a 6 or a 7. What we want to mitigate is the 20s or the 30s or the 40s, climbing up. So I think we learned from this, and great roadmap that's been built so far. I think we need to pay attention to that moving forward, and also compare it to other communities of similar demographics or size to learn what their norm has been and how they've handled it as well. So comparison data is very good and healthy. It's out there now. But I think that this community is actually in pretty good shape right now. We have a focus and we're working it.
Yeah, I think we do need to keep some of the focus on, while maintaining vigilance, that we don't have anyone who's critically ill. We have cases, but we have no one who's hospitalized, no one who's been transferred. And I think that that's a really important distinction in terms of living with the virus. And I think it is a very good point that the testing has been ramped up significantly, and people are being tested who don't have symptoms because they have been contact traced. So there's a lot better protocols in place than we had back at the beginning of this, and a lot that's been learned nationwide and worldwide in terms of how to function in some relative norms of daily life with maintaining vigilance protocols in terms of combating the spread.
Don, if I might add just one last thing, I think we've learned that we're protecting those very diligently that are most at risk, the very young and the very old and frail. And it's a shame that the elderly have to live essentially in jail because, a COVID outbreak in our island home would be, I believe, devastating. And a COVID outbreak in a very young population has shown that we can have detrimental results. But in between, I think we've learned to live with it. A lot of people don't know that they're symptomatic. It's good that they do know. It's controlling behaviors now so that we can protect those that are most vulnerable. And that's where I think our education and focus needs to be.
Thank you. Those are very good points. And also keep in mind that I don't know exactly what our population was over Labor Day weekend. Maybe the data platform has something on that, but I'm guessing that it was somewhere between 30 and 40,000 people. And even the numbers that we're dealing with are based on our 11,000 census from 2010 in terms of how things are calculated. So I think that that's also an important distinction in terms of how hard this has really hit our community compared to others. Yeah.
A slight correction, Don. I think we were running the 25,000 number, and Roberta was running it by 4. So we were using a sort of a Nantucket guesstimate of actual winter population, not a 10,000 number.
Well, it was actually the red metric.
Right.
Is based on the census. That's what I'm talking about in terms of us hitting that state piece.
Right.
So moving on from there, we got some feedback that there was a little bit of mixed messaging last week, talking about our grave concerns with the increase in cases, and then talking about potential events coming up this fall and winter. And I think that we wanted to get a little bit of clarification that a lot of these things are actually initiatives to help keep the businesses going, rather than true congregating events in the way they're envisioned. And one thing that is actually under our control as the select board is the New Year's Eve fireworks. And now that we do have the information that we could transfer that till next summer rather than paying for them for New Year's Eve, I just thought we might want to revisit that discussion and see whether we really want to promote during cold weather, having people grouping up in town to watch the fireworks. Janet, I'll go to you. I see your hand raised.
Thank you. I'm not sure what you mean by we can transfer it to next summer. I've not had a conversation with the fireworks company about that.
I thought that the last time we talked about this, they had said that we could go to next the funding for it. Did I?
Well, we've got a 3-year contract with them, so we have three fireworks events that we could have.
Okay.
And I guess we could do 2 in a year if we needed to. I will say that I've had conversations earlier with both the fire chief and the police chief that they felt that because of the way how many people would be here and that where the location of the fireworks would be, that they would be socially distancing opportunities along the waterfront for people to observe the fireworks if we wanted to do it for New Year's Eve this year.
I mean, I'm not saying that we have which way we have to go with it, but it did come up again as a discussion point at the EOC and from the public about mixed messaging and all of these pieces of fall and winter activity. Amy?
Yeah, I think, and I had this discussion with Chief too today, is the governor recently coming out and discussing the gatherings order, and something that's come up with some other events that we have that it is not allowed to, you're really not allowed to advertise any events that could possibly draw more than 50 people in a space if you can't control that. So I think that's where some of the messaging is coming from, and understanding, you know, this is the one that we're not sure. It's easier to say something like a stroll or something like that, where people will gather in one particular spot. We can't advertise anything of that sort. So I think that's where the discussion is, and it possibly needs state review as far as if that would come under that order.
And there was some communication from the Board of Health office with the state in regard to that. Christy?
Yeah, I was going to address the subject just as the president of the Chamber of Commerce. So just kind of recusing me from any sort of decision that we make about these things going forward. And we also have Bert Rice. He's the board chair for the chamber, just if there's any questions. And we also just wanted to announce that Melissa Murphy will be stepping in as interim. As many know, I'm leaving the chamber at the end of this month. So she is participating as part of the chamber as well. But just, I know that last week we started the surge, and then it was an agenda item of how the town was doing, how the chamber was doing on planning some of these kind of fall, what we're calling initiatives. And it was never really our intention to say that it was going to be, you know, stroll as normal. We've made it very clear to our chamber members, to our restaurants, to our lodging, that that is not what we've envisioned, that we're keeping COVID and public safety and our community safety at front of mind. We've been working with Amy and Janet pretty much since probably June of how we could re-envision some of these, what's allowed, what's not, how can we reimagine these things. So what we had done last week was put an agenda item of kind of how can the town keep working together to support businesses and kind of support some economic recovery from COVID. So what we presented was really just some initial ideas, nothing of concrete plans. We're going to keep adapting all the way until the date of, you know, some event, whether it's an event or, you know, a promotion of shopping local, but everything will just continue to be evolved and thought about as we move forward. And we're going to keep looking at virtual and safe programming that focuses on supporting our community and supporting our businesses through the holiday season, focused on how we bring the community together, even when we need to be apart. We're not advertising anything off island about people coming to the island. The chamber has been very strong in that position that we're really focused on the community and how do we have some holiday programming that, you know, allows children to see Santa, or an opportunity to have candy on Halloween if that's possible. So I just kind of wanted to say those statements and hope that we could continue these conversations over the next couple of weeks as things get closer. And, you know, we want to focus on the surge right now and just keep the conversation about community health and economic health going. So thank you.
Thank you. I mean, I think it's definitely an evolving discussion that we don't need to make any decisions tonight. I just thought it was something that we should continue to keep on the agenda and in all of our thoughts so that people can make plans. Matt?
No, I'm glad to hear that. I think some of the messaging was, a little misleading. It talked about weekend events. And, I think what that does, that builds expectations and I've said this last week and I've written the chamber and about this. I think it builds expectations to people who think, oh, everyone thinks of Stroll or thinks of different holidays and different events you guys run differently. Some it's alcohol, some it's gathering with family, some it's gathering with their whole neighborhood. Those expectations are all of a sudden, those are what people, sort of glom onto. And I think that, that we end up with, if we're not careful, we end up with another weekend like we did, on Labor Day, if we're not careful. And so I just think that we should be, very hesitant to have weekend events, to have, anything even seem like that even a little bit. I just think that's, I love what the governor's doing about buy local, and we should be buy local for locals. There are some industries that have done all right this year who, and some people who are staying long season who I think can be shopping Monday to Sunday on Nantucket, helping these businesses. We don't need to bring, boats here. We don't need to have extra boats on holiday weekends to help our businesses. I think we all can help our businesses. And so that was sort of my thrust on it. And I think we have to be very careful because even if we don't advertise off island, the word is out, the pamphlets are there, people, it's how we view things. And so, I'm glad to hear that we're going to be, sort of careful with it and not not go the wrong direction.
Erica, then Christy.
Sorry, I just wanted to note that our office actually has started getting calls about Stroll, wanting to know if it's really happening or not so that people can make plans. So, just
yeah, that's been a concern for me. Christy, I'll go to you. And then Bert has his hand up as well.
Yeah, and the chamber has been receiving calls, as has visitor services, and we've been very clear in talking with our lodging establishments and anybody who calls that it's not Stroll as usual. And we've actually had a conversation today about changing the name for this year so that it really makes a distinction that this is not, Stroll as usual. There's no bars open. We're not promoting coming here and gathering, and it would really be focused on our locals trying to get out, going back to what Stroll was all about. That weekend was created by locals for locals, and it grew from that. So as you mentioned, Governor Baker's initiative, that's really what we're focused on, is this My Local campaign. How do we get people to, get out and dine? Gary Shaw brought it up earlier. We want to do it safely, support our restaurants, support our retail. There's things that we can be doing to support our local businesses without promoting or congregating in one area at one time. And as much as the things that we can do virtually, like the tree lighting, all of that is going virtually. So there is no large crowds gathering. We're really considering every detail of how to prevent people from getting together.
Bert?
Yeah, I just wanted to kind of reiterate what Christy has mentioned as we make our transition at the chamber. There is a lot of question. There is a lot of concern. And as a chamber, we represent just over 785 members. Most of those are small businesses on the island that have really taken hold onto what the chamber says. And they think off of every single word and say, hey, what are we doing? We've given them information. Christy and the staff and now Melissa are doing their due diligence to make sure that that information is out there. One of the things that is concerning is people view something because they see a word Stroll, they see a word Halloween or something like that, and they get confused. So one of the things that we are looking at is making sure that we are making sure that they are initiatives, they're not events, people call them whatever they want to call them, but that we are doing our very best to not set in stone, but also to remember that if it's not for our local businesses who are trying to remain open on every penny they have left, then we're not doing our due diligence as a chamber to help support them. in what their efforts are as well. So we're just trying to do what we can as a chamber to make sure that we're putting things out there, not to bring tens of thousands of people over, but to also allow our local people who are already dealing with all kinds of mental issues and emotional and everything else, an opportunity to say, hey, you can social distance, you can mask, you can do all the things, sanitize, get all that done, and still have a good time with your family. And I think that's the message that the chamber is trying to put out. And if it's gotten out there wrong, we apologize, but we're making sure that we put out the right wording. And I think that's what we're trying to get across.
Matt?
My suggestion, the right word, if they call Erica or call the chamber, is no. Are we having stroll? No. That's the right word. We on the and I think we heard some convoluted thinking on the other night about if someone has a wedding and they only bring 50 people at a time to the gathering, and then the 50 people leave and another 50 come, that they're in compliance. That's sort of convoluted thinking. That is not true. And I think we have to be careful that we aren't encouraging things like that as well. So we just have to think about that. We can't be saying there was only 50 people there and then, 20 left and 20 more came. If a gathering of 50 is 50. And I think we have to sort of, and how would you enforce that? And if there are sick people in the first 20, there's a couple sick people at the beginning, it could ramp through everybody anyhow. So I just think, we have to be very, be aware of this. And I'm a chamber member. I want to support the businesses, but all along I've been more worried about what happens if we end up in a worse situation. We haven't done that scenario planning. We haven't shown people what would happen again, but we lived through it. And I think people have to realize that, if we get 80%, 70 or 80% of what we used to get from now through the fall, and I think we might get more than that because of the people who are staying, that would be a huge victory. So I just, those are my comments.
Janet?
We've been focusing on stroll, but we've got some events coming up, or there are some events coming up in October. And I've been working closely with the chamber, particularly on the trunk or treat event with the school district, who have offered the parking lots for that event. So if that's not going to happen, I think we need to get that, whatever the directive is from whatever agency is going to do it, that information out early so that the chamber can plan what they need to do and families can figure out another way that they want to celebrate the holiday. It really was a well-intentioned effort to give something for the kids to do. And because I think it's been I know it's been a tough period of time these last 6 months about interacting with other people. And I will also add that the cancellation or the postponement of the New Year's Eve fireworks will not incur an expense if we make that decision before Thanksgiving. So that's kind of the timeline for that. But I would ask for some direction at some point within the next few days about the trunk or treat event.
Are there any more thoughts on how we can safely do the trunk or treat event? There was discussion about making sure that everyone stays within their cars and doesn't comply with the guidance from the state. Maybe we can get more direction on that from administration in the next few days. Okay. Yeah, I think that we just need to continue this discussion and continue looking at what's happening. I do think that stroll is the big one in terms of it's something that's happened year after year after year, and it's a big congregating event. And it is hard if you, what Matt says, it is hard if you don't say, yes, it's canceled in terms of the messaging. But at the same time, I hate the idea of taking that away from businesses, but I don't know how to differentiate it completely and say, like, Main Street's going to be open. It's not going to be closed down. There's not going to be any carolers. There's not going to be any Santa Claus parade. and get that true message out there to people. Also, we need to know if the restaurants are going to stay open or if they're going to do some packaging of like takeout food. Melissa, I'll go to you.
Thanks, Don. I think you're asking a lot of really great questions that at every table I sit at, everybody's asking. Lodging is seeing that bookings are down. People are not or interested in coming or hesitating to come. I think it's very clear to our returning visitors who either have seasonal homes here and enjoy and stroll revelry, or our visitors who plan to come every year, that this year is different. And so the expectation is already set that it will be a different year. I think that Christy and I spent a lot of time talking today with staff and the Lodging Association and brainstorming. And I think that, you know, exactly what you said, there's so many unanswered questions right now. So our commitment is to continue to keep this board updated with what the thoughts are, how they progress. I think it was important tonight that everybody hear the commitment from the chamber, that community safety is, of course, at the top of everyone's mind and every decision that's being made by the board of directors and by staff and with all of our stakeholders. In fact, at the Lodging Association today, there were members there who were talking about, you know, we don't want you to promote stroll on behalf of our businesses because we want Nantucket to be safe, and we'll be okay if we have a different season. So I think what you'll see is a rollout of an event that will be obviously, or a celebration of the holidays and supporting our local businesses that's going to be very different than what we've ever seen. And it will not be a traditional conduit for revelry and celebration in the way that we've seen it in years past. And if you can bear with us while we get through asking those questions and getting answers from the businesses, then I think, you know, our commitment is to remain transparent with you about what those plans look like.
Thank you. I think that we'll just continue this conversation, if that's okay. If anybody doesn't have anything else, if there's nothing else. Amy, did you want to talk any more about order number 46 and about any other licensing items?
Yes, I'll try to. I wanted to speak a couple different times in there. I had a couple things to point out. I didn't want to kind of get in the middle. I'll tell you a couple things that we've been doing. First of all, in regards to events, obviously we work very closely with the chamber and everyone as far as how this is going to look. I think we agreed too that we talked about this week, the difference between an initiative, meaning buy local, shop local, is different than, you know, having an event that supports that initiative. And we certainly are looking at more of creating the Nantucket experience that people can enjoy throughout the holidays, throughout the fall and throughout the autumn, being the shopping and the outdoor dining and things of that. And I have an update on that. So that's kind of what our perspective is. Last week, in response to a lot of this and the gatherings order and wedding season upon us, we sent out an advisory that covered every event planner I knew, inns and restaurants and vendors and NARAB and real estate folks and all these corners that we could, an update on all of this to explain it. And some of the main points we're really dealing with as well, and the questions I'm getting is sometimes people still from prior to this have a distinction between, well, it's a private event. You know, we don't need to follow this or the rules. And even some restaurants had asked me that, well, it's a private wedding. Can they have a cocktail party and things of that sort? And the answer is no. The virus doesn't distinguish between whether or not it's, quote, private. And the occupancy gathering limits is based on human beings in one space, not staff versus, you know, guests versus this versus that. It is occupancy, all humans in that space. So we wanted to clarify those things very importantly. And again, the 50-person limit outdoors, even if in your backyard, if it's more than 10 people for multiple households, masks are required, things of that sort, is to understand that this goes across the board. So we got that message out. saying it's every gathering, event, party, wedding, backyard barbecue that these guidelines support. The masks, and then we also certainly reviewed the responsibility of following these protocols with all of these licensed vendors and facilities too as well. Reviewed ways of reporting, and I now understand that some people have difficulty accepting that this is the way it is for their wedding, and to certainly send those folks to us. And that has worked because I've had some brides call me this week as well to see if it's okay if they dance, have their first dance and things like that. So, we're having those conversations. I just want to assure everyone we've kind of tackled that area. We get a tent report every week to see where tents are going up and kind of review that with the building and the tent companies and kind of see what those events are at the private homes. So we've added that to enforcement as well. So we kind of know what's going on there. And so that's kind of that review on event and gatherings. In addition, we received an update from the state as far as outdoor dining, which originally was Order 35 by the state and supported by our local Order 11, which the governor updated that and is now allowing the extension of outdoor premises for on-premise consumption establishments, liquor licenses for on-premise consumption. They are allowing the local licensing authority to approve these extensions until the end of the state of emergency and no later than 60 days following that state of emergency. Okay, so that has been updated. I think what our next step there is I'll talk with health and the Board of Health as far as updating Order 11 and give you all a recommendation as far as that is concerned. For instance, Boston said, they're valid till December 1st and can be removed immediately to allow for snow removal. God forbid we have to do that before December 1st, but kind of updating it for that so that they can do that. So I know a lot of restaurants were hoping that would happen. Originally it was November 1st. So we are given that ability. In addition to that, we have requested further. The grant program for the state is now allowing us to ask for additional grants for heaters and lighting and certain things that will help these spaces. Originally, we were denied that to use that grant for that. So I will hopefully update that in the coming week or two as well, so that we can hopefully help support outdoor dining past September when it gets a little chilly. So I think those are, and we'll bring that to you in the next week or two as well, as far as that recommendation. But that was good news there as well. I think that is the main update on that. Any questions?
Matt?
Just a comment. I think you're absolutely right about the restaurants. The National Restaurant Association, $240 billion is what they estimate restaurants are going to lose in this year. There'll be approximately 100,000 restaurants will close across the country in this year. And the sales in August, which is probably going to be about the busiest month because the weather's the nicest, was down 34% countrywide. I'm surprised it was only down that little myself, but so those are just some real numbers. It's an issue.
Correct. And just to follow up on that too, and I'm going to kind of go out to the restaurant group as a whole. I'm starting to I haven't gotten anyone closing for good, but I have gotten a few folks that are going to close up early, going to close up in October again. Some people are asking who's going to be open at Stroll that general weekend. We don't know. They're week to week. So a lot of folks are asking to close early. They might not open again until spring and things of that sort. So we're trying to catalog that right now. But again, a lot of folks are week to week with staff and everything else. So it's going to kind of be up in the air to see who is around that week as well. But I'm going to try to gather that information a little bit more for you as well.
And in general, on those weekends, the last few years, the number of people that come, sort of Thanksgiving through the next week has increasingly become people who own homes here. It's second home owners. I think a lot of them are still going to be here if the island is perceived as safe. If it isn't, they'll stay home. But I think, I think that there's still going to be a fair number of people here. So I think that's, take it for what it's worth.
Yeah, correct. That's why we're hoping to support the Nantucket experience as it is right now with the dining and shopping and trying to help further that throughout the season. So, yes. Anything else?
Thank you, Amy. Anything else? Thank you, Amy. We'll look forward to continuing that and let us know what actions we need to take. So I don't think there's anything new on emergency orders. I mean, we already heard the important information that nothing's being proposed for the Board of Health meeting tomorrow. And I don't know that there's any new public information or town services update.
Not really. Roberto mentioned the hits on his video. We are getting, still a lot of traffic on the town website about COVID information. We had actually been talking about opening town offices to some extent for appointment only last week, but then we thought we should hold off on that a little bit. And so we're going to continue to reevaluate that. But if people need something, they can get it. We haven't heard anybody who say they can't get something. So just keep emailing, texting, calling, and you'll hopefully get what you need.
Thank you. I'm going to move on from COVID this evening unless anyone has anything else or anyone from the public wishes to say anything or ask anything. I'll move on to public comment for items that are not COVID-19 related. This is a chance for anyone to bring anything to our attention. It won't necessarily get commented back on tonight, but anything that's not otherwise on our agenda for discussion. I don't see anyone raising a hand. No new business. Approval of treasury warrants. Could I have a motion?
So moved.
Second.
All those in favor by roll call: Matt Fee,
Aye.
Jason Bridges,
Aye.
Melissa Murphy,
Aye.
Steve Martella,
Aye.
Don Holgate, aye. Thank you. Citizen departmental requests. We have, this is a committee that I was on, the Senior Center Relocation Expansion Feasibility Study Committee, and Julie Fitzgerald was our chair. She is with us tonight. And I would like to turn this over to Julie if she's ready.
I'm here. Can you see? You can't see me, can you?
No, but I can hear you.
Okay. Can you see me now?
No.
Oh dear. Okay.
Julie, this is Erica. Do you need me to share the screen at all with the report?
Yes. Why don't you put it up while I'm trying to find out why I can't come up here. I was having with the webcam for some reason. Oh, am I there? I'm there. So hello everyone. The last time we were here before the select board was June of 2019. Senior Center Committee's now been working for approximately 2 years, since 2018, studying potential sites for a new senior center. I think I'm going to start with a piece of property that we were looking at, which was 1 West Chester Street, because since 2019, when we last made a report, the committee has been reviewing that property. There was a feasibility study done by an architect. Unfortunately, the ultimate conclusion by the architect was the acquisition and renovation of an existing multi-level dwelling was going to exceed the cost of doing a new build, and there would be a less satisfactory use of space and accessibility in the property, even if it was done and could meet all the accessibility requirements. So that was very disappointing because there was a lot of excitement generated by that particular piece of property. There was an opportunity for the public to see that site a number of times. We held a meeting there. And the owners of the property, we need to thank them because they made their property open to the public any number of times for people to view the property and walk through the property. So unfortunately, that is not one of the recommendations that the Senior Center Committee is making. Another that came out of the feasibility study, however, is the architect was able to do some preliminary floor plans and elevation plans. I think that's a good opportunity so that you can have a vision to see what the senior center would look like if it's basically a new build on a different piece, on a piece of property somewhere. So I think that was a positive item that came out of the feasibility study and working with the architect for the money that was spent for this review process. The properties that the Senior Center Committee has reviewed and is recommending, sort of at the last minute, a reconsideration of the Island Home property, if that was ever available for a senior center. That has pretty much the prime recommendation of all the Senior Center Committee members. The concern has always been when that would possibly happen if the Island Home moves to another location. So the architect did not actually review that particular property in his study because, again, it really came up with one of our last meetings as a consideration. But I know the town has had a lot of studies. The last LWDA study had a lot of information about that site. It seems that if the Island Home could either be rebuilt there or in a new building there, that it would probably be more than adequate for a senior center based on the proposals that the architect had provided to us. Another discussion that came up at one of our recent meetings, the last meeting, was whether or not there should be any other interim locations that could be a possibility. We really didn't have anything specifically in mind for that or was proposed for us. I believe maybe Ken Bogran, the real estate specialist, is still continuing to look at other properties that might be an opportunity for a senior center, either temporarily or maybe a permanent location. So that's something I think we'd like the select board to continue to consider. Back in 2019 and currently the Senior Center Committee is still recommending the Sherburne Commons site. Again, in the package, in this report, in the package of materials, there's a plan showing a location which was acceptable to the Sherburne Commons entity for a location. It would have a separate entrance. It would have adequate parking. So it would sort of create a senior community if a senior center was located there. I think one of the positives of that, that location is that it would not require acquisition of land for this particular location. I believe it does require the renegotiating of a lease with Sherburne Commons in order to make this work. So that's really in pretty much the report in full is where we ended up at the end of 2 years of studying the project. But we certainly would like to keep the senior center in the forefront of the select board's consideration for capital planning. There's definitely a need for it. And sometimes under difficult times like this, an opportunity might arise. So I think we need to keep our, eyes and ears open for opportunities. So thank you. And I want to thank the Senior Center Committee and all the work they did, the town staff that assisted us. And certainly we were really pleased the numbers of public that attended these meetings. It was wonderful to see all those people there and provide support and their input in reviewing the process.
Thank you, Julie, and I really appreciate you putting the report together on behalf of the committee. And this really was a very engaged group of people, and I hope that we can, continue to move this forward while we have so much public engagement. And I really do recognize that we have a very strong need to improve the senior center for our community. It's way undersized right now. Any questions from the board or from the public as well? Comments? Melissa?
Just a comment. Thank you very much, Julie, and to the whole committee, Don, for this report. I found it really easy to read. I thought your examination process was really thorough, and I appreciate your feedback. I think it's great that this is on an agenda where we're also talking about recreation for our community as a whole. And I think there are a lot of places where there's room for improvement for every segment of our population to recreate more safely. And the senior center is certainly one of those for me. So I just wanted to thank you, and the report was very easy to read, and your reasoning for your recommendations was very clear. So thank you.
Thank you.
Yeah, I thought the report was great too, Julie. Thank you. You know, and I had looked up how big the island home is, current island home. It's about 20,000 square feet on one floor. And the proposal you guys had was about 12,000 square feet. So I agree, it could be that's the ideal place for the senior center. If we can get, if we can get the island home moved to Sherburne Commons and do that in a relatively, quick time frame, or find a stopgap in between, that would be my that would, I think, be the best solution. And I think you've identified that. So hopefully we'll find the way to do it.
Thank you.
And I will note that we do have concurrent initiatives in terms of further analysis of the island home and some analysis on other pieces of property that could be interesting. So there are hopefully all of this will come together in the near future.
So I guess unless the select board gives us further direction, or the town administration, I don't believe we have any plans to have any continued meetings until we hear some new information from the select board.
I think that's probably where we're at.
Yeah.
We'll reconvene the committee once we get a little bit further with progress on some other analysis. But I think it is important for us to move this initiative forward. Anybody else? Anyone from the public that has a comment or a question? Okay, well, thank you, Julie.
Okay, thank you all. Have a good evening.
Not a ton of questions. Next up, we have Sandy Peddle's bike share.
Hi, yes, thank you. I'm going to just give a brief update as to where this is. And I included a basic service agreement, MOU, in the packet for bike sharing services I put together. No one's having a good year. Poor Tom Holt here, who's trying to put this together. Where it stands right now as far as operation is, he had the bikes, he has to put them all together and put them together, but apparently the GPS lock or whatever that is in customs somewhere stuck, which it's not funny, but it's been one of those things. So unfortunately he's waiting for that and trying to get it out of customs. So that's kind of where the delay is. We have this put together. He's hoping, and this is a hope because who knows when things are going to get delivered, but hoping end of the month or October to try this. So basically, I got through legal, a basic MOU bike sharing agreement that just talks about the use of town property. He has proper insurance. We've identified locations for the hubs as far as storing some bikes. Again, he's only using up to 50 maximum for the beginning of this, many being on private property, but some on town, and then destination location. So, my recommendation is just to license for the calendar year and revisit again in 2021, because, there's just no way, I think, in this case to get the proper data that we need or to understand the operation enough to move forward with either a full program or what have you. So I think that's where it is. I think we've just put this together based on our previous conversations and agreements to just basically allow for the use of these properties to stage some of the bikes and things of that sort. And hopefully if you can get up and running for a little bit in October and through if weather's okay, and kind of get his feet wet in that, and we can revisit in January and see how it goes. If there's any questions or comments on that thought from anyone. No. So if everyone's good with that, I think we can kind of move forward and do that temporary license based on the agreement, and just hope we can revisit and have a normal year next year for this. Good. Okay. Okay. Thank you.
Thank you, Amy. Next, public hearings. We have a public hearing to consider an application for a mobile food unit for Nantucket Native LLC DBA Eat Fire Farm. I'll open the public hearing. And Matt.
Yeah, I'm gonna abstain from this. I'm not charging rent or getting anything from Dylan, but I'm gonna not participate in this.
So you're gonna recuse.
Recuse, there's the word. Thank you.
Maybe just turn off your camera for this. Okay. Walk us through this.
Yes, so we have a mobile food unit application, as you mentioned, for Eat Fire Farm. I believe Dylan is on this call as well. Pretty straightforward mobile food unit. I believe it was had been licensed, if you remember, Roman Pizzeria, but that license had expired, so we went for a new license. And where did I put that? So he will be operating a similar type of pizza. We have a menu in there as well. Oh, here we go. Sorry about that. He has submitted, as you see, the location agreements as required, has his approved food service plan through the health department, and agreements as such. And as we like to say here too as well, mobile food units, any location not approved or for a private event has to be noticed to licensing and possibly the select board. And there is no service for mobile food units in the downtown historic district. Further from that, there's no objection to this application, as he has everything filed as is required. Any questions?
This is a public hearing. Are there any public comments? I don't see any hands raised. Are there any board questions before I close the public hearing? Okay, seeing none, I'll close the public hearing. Do we want to just go to a vote? Does anyone want to make a motion?
Motion to approve.
I'll second.
All those in favor by roll call: Jason Bridges.
Aye.
Melissa Murphy.
Aye.
Christy Ferrantella.
Aye.
John Holgate, aye. Next, I will open the public hearing to consider an application for 2 mobile food units for Cocktail Court LLC DBA Saltbox Tavern and Table.
Yes, thank you. So this application is for 2 units. Oops, sorry. Let me talk over you.
Matt's back on with us just to make for the minutes. Okay.
Okay. Okay, so this application is through the owners of a Saltbox Tavern and Table. The request is for 2 mobile food unit licenses. It's 2 trailers. This is a little bit different request. Currently what they are asking to do, and I believe Genevieve is on this call too as well. She might correct me if I'm incorrect on explaining this, but trailer, at least one, will be located in the parking lot with property owner approval adjacent to the Saltbox Tavern and Table, in assistance to not only will maybe one of the trailers be used as a mobile food unit for private events and such, but to assist in their ability to operate through the winter for takeout and such. As far as, having less staff and location, that it's easier for them to do it in this manner. I believe too as well, we've given you a map of the area to the proposal that would come with some seating, blocked off seating in that area for folks to eat on premise is there as well. Therefore, I'm asking for a approval. And again, they've had all their food service reviews as well, and have their commercial kitchen on site there as well as for the mobile food unit, but also an expansion of premises to allow for additional seating in the parking lot per the emergency order 11 and 35 that we've done previously I will make a comment on that I've spoken to them too as well, is that the plan is that the trailers will not be operating if the main kitchen is operating and they are serving in their current space as well, and that no occupancy can exceed their current occupancy with additional expansion. So those are the comments on that as well. So any questions?
Jason?
Amy, thank you. Did you say that if their kitchen is operating in the restaurant, it can be operating in the mobile food unit? Is that what I heard?
I believe, and I'll ask Genevieve too to make sure I'm saying it correctly, is that this is to supplement and to make it easier for takeout and those types of things for breakfast and lunch for their facility as well. But there will be a time when the main kitchen is used for the current dining seating that has been previously approved. Is that a correct way of saying that, Genevieve? If she can hear.
Hi.
Well,
Can you hear
ahead.
me?
Yep.
So basically what we would like to do is use the mobile units from 7 a.m. until about 4 o'clock in the afternoon or 3 o'clock. And then at 4 o'clock, open up the restaurant. We would shut the mobile units down and then have an hour in between and then open for our evening dining at the restaurant. So we would never be sitting outside on the lawn or in the dining room at all while we're sitting in the parking lot.
Does that answer your question?
Yeah. I mean, it helps with their operation, understanding kind of what they're going to do. I think that sounds great. Everyone's trying to figure out how to get through this, and seems like a great option for them. I wasn't sure if you can have both operating at the same time. So I feel like there's businesses that are doing that has a food truck somewhere and their kitchen's operating at the same time. I don't want to put that stipulation on them if we didn't need to.
Well, excuse me if I may. Jason, maybe next year we'd look into something like that, but right now we're just basically trying to get through the winter.
Okay, so you're saying you're not going to do that. Like, you want to do this.
Our plan next summer, when we don't need these, is to lease them out. So probably they would be operational while the restaurant was going, but in a separate location if we got approved for that. But for right, and I don't know if we would have to come back and revisit that at another time. I kind of hadn't really gotten that far. So it would be nice if that stipulation wasn't on there, but we could always revisit it at another time.
I may have explained it incorrectly, that they were just going to do separate type of operations. And I was just putting the caveat, and it's tough because we have such different rules this year because they are expanding into the parking lot, which is allowed based on these orders. So next year might be different, but we can deal with that at that time. So I was just kind of putting the caveats on there, but we wouldn't say they can't. But
Okay.
they couldn't exceed their total, whatever their current occupancy is with the expansion, as we've just said before. If they're, and I forget the number, but say it's 80, they can't suddenly have 90 seats using the lawn in the parking lot.
That makes sense. Thank you for the clarification.
Thank you. Christy?
Thank you. Just one more clarification. This is for 2 units, so one might still be in operation while their kitchen is open, if that was for events or a catering, right? Okay, so that's included. Okay, so
That would be correct.
Okay.
This is a public hearing. Before I close it, is there anyone from the public who wishes to speak on this matter? Okay, seeing no hands raised, I'll close the public hearing. Anything else from the board? Is there a motion?
Motion to approve.
Second.
All those in favor by roll call: Jason Bridges,
Aye.
Melissa Murphy,
Aye.
Steve Garantella,
Aye.
Matt Fay,
Aye.
Todd Holgate, aye. Thank you.
Thank you.
Amy, thanks for your continued work on helping all these restaurants keep things going.
Thank you.
Next up, we have the town manager's report. Libby, did you want to introduce Park and Rec?
Sure. So we have on the screen Tom Desmond. He's the chair of the Park and Recreation Commission. They have been reviewing or have reviewed the Parks Master Plan that we reviewed with the board oh, wow, many months ago. And the commission has endorsed the plan, and Tom is going to just make some recommendations as to capital projects that we'd like to work into the capital improvement plan. Tom?
Thank you. Can you hear me, everybody?
Yes.
Okay, great. I just want to start off by acknowledging some of all of my fellow commission members. They're just a great group of people, and I'm delighted to count them among my friends now. Jack Gardner, who you all know, I'm sure. He's a repository of knowledge, particularly with regard to the park system on Nantucket, and is just a true gentleman through and through, and took a big leadership role in this whole analysis. And Diane Flaherty, equally as rich in history and competent and just a pleasant person. And Emma Young, who has a very keen and astute business acumen. She really drilled down into the document and brought out a lot of business issues that didn't occur to me and probably some of my other commission members, and really compelled us to reflect upon them. And then Blair Janelle, who I'm sure you all know, and he's does a lot of programming, youth programming on Nantucket for the youth and young adults, and that's very, very important, as you can imagine. And I also want to thank Libby Gibson and Rob McNeil and Maureen Coleman for helping me and the other board members navigate through the nuances of town government. It was very, very helpful. So the document itself, just give you an overview, the basis for our recommendation and basically the task that was put before us is articulated in the Parks and Recreation Master Plan, which was tabled last November, formally tabled. And just some general comments that we had, when I say we, the commission, had regarding the plan itself. We thought it was thorough. It was well conceived and properly laid out. We believe the author did, Weston and Sampson did adequate due diligence. They did the appropriate outreach. They covered the different sports programs. I think it was well communicated. We think it was well communicated to the community. They had several meetings, all documented. People signed in. I myself attended one back in August. It was very well attended, and Rob and the gentleman from Weston Sampson did a terrific job laying out the plan itself. And more importantly, they identified all of the key issues that we face on Nantucket with regard to our athletic facilities. No stone was unturned. So I think everybody's concerns were addressed. And they also made helpful recommendations and observations. So we did drill down into the document. I'm sure most of you have read it. I think, most of the people in town have read it who are interested in youth sports. And it's actually pretty exciting to see the length and breadth of it is for me anyways, very exciting. So we, as Libby mentioned, we voted on phase one to move forward with phase one. It was unanimous. And the key components of phase one are going to be affecting Nobadeer, Delta Fields, and Tom Nevers, as you probably already know. And, those places are real gems, in my opinion, and the opinion of my fellow commission members. Some of them, there's work that has to be done out there, but we think that Nantucket's very fortunate to have those sites. Tom Nevers is right on the ocean. It's absolutely beautiful. I live out there. That's where Marcy and I have our summer home. And Delta Field and Nobadeer are contiguous. That path connects the two. So it's almost like the emerald necklace of sports on Nantucket, because it's also connected to the paddleball courts and the Nantucket yacht club, not the yacht club, whatever. What's it called, Libby? What's the yacht club over there near the
Great Harbor.
Yeah, Great Harbor. So I think our high school kids can use the Great Harbor tennis court. So what we have is a contiguous athletic facility beginning at Delta. You take the path through the woods and you come to Novadear. Then you take the path further down and you're right at the paddleball courts and Great Harbor tennis courts. So, you know, a parent could drop their kids off at any three of those facilities. And if you ran a golf cart from one end to the other, you wouldn't have to get in your car and drive around. So I think that's a great asset. But so basically, phase one, as I said, is Novadear, Delta, and Tom Nevers, and they published some preliminary budget numbers. I don't know how realistic they are after this COVID disaster. I'm not sure whether they are still relevant, but I'll let you know anyway. The low number for all three fields, the conservative number is about $15 million, $14.5 million. The high number is about $19 million to do the appropriate work that's collectively on all three fields. I would go with the 19 million for purposes of discussion and any decisions that you make going forward. But obviously, I'm sure Rob and his team are going to drill down further into what the actual cost is going to be. But we all know construction on Nantucket's not cheap. And even if it wasn't on Nantucket, these prices are really, for the work, the scope of the work that's going to be done, I think they're pretty much in line. So finally, I just want to, before I take questions or answer any questions you have, just say that the real challenge in any project like this, and I'm sure you've all been through many construction projects over the course of your career, you know, it's very difficult to build a project like this, to keep it on time, keep it on budget. Communication's important, but the real work, in my experience, particularly with parks, comes after it's all done. And so we have to start thinking about a security plan, a maintenance plan, and a programming plan, plus a reinvestment plan. But it's a very exciting project for the island. It's very important for the island. I don't think it's extravagant. It's not close to being extravagant. It's really a lot of repairs and maintenance involved in this, stuff that should be done anyway. But nonetheless, it's just a great opportunity for the island. And we recommend that that the island move forward with phase one. So having said that, I'd be happy to answer any questions that you might have. And if I don't, I'll defer to Libby and Rob.
Thank you very much, Tom. Questions, comments? I'm really excited about getting going on some of this stuff. I hope we can work it in. Melissa?
Yeah, thank you, Tom, and thank you to your group. What a great group. And I know this study has been underway for some time and talked about for probably twice as long, but it is really exciting. And I hope we can find a way to make a commitment as a town and with the schools to really improve our recreational spaces. This is the way it's laid out. The study is so comprehensive, and it's just needed. We are a world-class destination. We're a world-class community, and all of our families who live here deserve recreational spaces that are safe and accessible to everybody. So I really appreciate your report, and I look forward to the ideas about how to get started and finance some of these initiatives. Thanks.
Yeah, just let me add one more point on that theme, is that I've been involved in these types of projects before, and you know, nothing brings a community together quicker than a good park system. And you'll find that to be the case here, I'm sure. And it's just I mean, the facilities themselves are beautiful. I mean, you basically have a clean palette to work with. I mean, you know, go out to Tom Nevers. I mean, who wouldn't want to fix that place up? And then you go to Novadear. I mean, then you go to Delta, and it's a big footprint. And, you know, it's just a beautiful spot for such a small island and, you know, a space-tight island, to have all of this open space to develop. is just really remarkable. You know, I would encourage you, if you already haven't, and you know better than I, but just take a walk from Delta Field, cut through the woods there on the path, walk along Nobadeer, and then all the way over to the paddleball courts. I mean, who has that kind of space? And it's really undeveloped. And with the construction expertise on the island, you know, to your point, you should have a facility that's, you know, second to none. And you have the programming expertise with Blair. You know, he knows everybody for youth sports, and you have a good youth sports community. So it's a great opportunity. And it's going to go, one of the comments that, you know, Rob McNeil made at the presentation when I first met him on Tom Nevers is that this program looks out 50 years. It really does. So none of us are going to be here. I know I'm not going to be here in 50 years, but it's a 50-year, it's going to have a 50-year impact on the quality of life on Nantucket. And make no mistake about it, it really is going to. So it's important what we do now.
Go ahead, Christy, and then I had a question.
Yeah, I just have more of a comment and a thank you to Tom and the committee for putting all of this together. You know, we talk about our strategic plan a lot, and part of that is quality of life. And I think this is a huge step in the right direction of, you know, enhancing the quality of life on Nantucket. So thank you for all that work. And as Melissa said, much more eloquently than I can, I think we're really excited to push this forward and figure out how to finance it and such. So thank you.
Yeah, just on the quality of life issue, I think you're absolutely right. And one of the comments that was made in the report is that it didn't address indoor facilities at some point down the road. I think you have to address that. It's important too. We have some ideas on that, but this evening's not the right time to discuss it. But you know, we also have to help young adults do something at night.
I completely agree. That was actually that was going to be my question about giving, or just a comment about giving some thought to, I've had a lot of people asking recently about bubbling some tennis courts for year round and nighttime play. And I know there's been talk in the past about some kind of an indoor running track and those other kind of things that promote year round healthy quality of life.
Yeah, the board has been informally discussing conceptually what could be done. And, you know, we all know that the weather on Nantucket changes second to second, and you need to do something about that. And I think there are ways you can do a lot of good things with an indoor facility without spending a lot of money. I mean, for kids, you really don't need a fancy Taj Mahal. You need basically an I-beam and some you know, sheet metal with a little bit of heat that takes the temperature up to 65 degrees, put a coat on them or a sweatshirt on them and let them run around for a couple hours. You know, we're not talking about millions and millions of dollars. So, but that's for another discussion. But phase one, it's very exciting. You know, I'm just so happy that, you know, Libby gave me the opportunity to work on this. It's because I love parks, and as we all do, right? And it's just going to be a lot of fun for the whole town.
Absolutely. Thank you. I'm going to go to Matt.
Yeah, I think, you know, I think one of the most important things you said was having a plan to endow these or have the money available and the staff available to take care of these. A lot of times we get the first step done and the second and the third aren't completed. And we need to, if we're doing a 50-year plan, we need to do a 50-year plan for those, you know, those items as well. I was involved with creation of Delta. I'm that old, and we did a lot of fundraising for that. And part of why we did it is we would get kicked off of fields. You know, whenever we tried to play soccer anywhere, we would get kicked off. And it is a huge, you know, flat field space is a huge issue on the island. And I think it rolls right into our equity discussions. You know, part of what we're trying to do is provide what is needed by the demographic and the people that are here now. And it is a huge part of their lives. I ran the adult soccer league for a number of years. My kids have been involved, and it brings people together. And so having that for young adults and for, you know, people their families will go and spend all day Sunday at the field, and they'll have picnics, and, you know, and everyone is together. And it's, it's sort of different than the culture I grew up in, but it's the culture that is on Nantucket now. And I think that if we can find a way, there are going to be a lot of competing interests, and it's not going to be easy to fund this. But I think if we could find a way to do it, it would be very appreciated and very needed.
I couldn't have said it better, and I agree 100%. Just to repeat what I said earlier, Parks and Rec bring people together, period. And programming, children programming, young adult programming, well-maintained facilities. I have a lot of experience with this in Boston, and it's amazing what can happen to a community on the positive side when this is done right. And when I say done right, it requires nothing complicated. It's blocking and tackling, making sure the place is clean, making sure there's a maintenance budget, making sure there's a capital reinvestment budget. And if you schedule all this stuff out, you can get it done. And so I agree with everything you said. It's absolutely on point. And it's a good deterrent to substance abuse, racial tension. You get a sports league. I've seen it in the big cities in Boston. If you get kids playing together, they get to know one another. Their families get to know one. It takes the edge off. It takes the edge off when you have kids playing together. The families come together. It just happens naturally. It's not forced. It's just a natural consequence of having a good park system.
Thank you so much. I think we all are very supportive of moving this forward. Libby, do you want to continue with your?
Thank you, Tom, very much. Very much appreciated. We'll move forward to get these items worked into the capital plan. Thank you on that.
Thank you.
The monthly town management activity report. I won't go through every single item, but just some highlighted things that we've been working on lately. There's some ongoing plans, reports, and studies as noted there. A lot of meetings on various things. We're starting to have more capital project and budget and town meeting preparation meetings. So those are starting to get underway. I've been trying to get to Cape Cod Managers Meeting monthly. We've been doing those on Zoom, and they're usually pretty helpful. A lot of towns are going through a lot of the same things. It was sort of gratifying that our friend Chatham is in the red as well. And we've been able to share a little bit about what they're doing and what we're doing as a result. Pond management, I had a meeting with our pond management coalition chair the other day, and that's Bob Williams. He's going to come and give the board an update on ponds and what the coalition's been up to in October. Obviously, the last week or so, we've been spending a great deal of time on the so-called September surge of COVID. So that is, a lot of things have had to be put aside again to deal with that. A lot of projects, still some COVID projects ongoing. Other projects that are listed there, we have our long-term planning forums underway with our island home. Those are going pretty well, I think. Let's see here. I don't want to go over every single thing. PFAS remains an item at the forefront, and we have a group meeting that is going to be meeting regularly. We had a meeting a week or so ago, maybe it was 2 weeks ago now, with the consultant, CDM Smith, that is going to be doing our island-wide risk assessment. The third sewer force main's taking a bit of time. I think I forgot to mention this earlier, but on August 18th, Dawn and I, the chair and I, received on behalf of the board an award from the hospital for our work in the beginning parts of COVID. So that was really nice. And I just wanted to make a note, there are a lot of things that we had to put on hold due to the pandemic response. And I've tried to list some of them there because some of these have come up a little bit here and there. And I sort of cringe every time they do because I think that's on my desk, that's on my desk. And I just can't get to it right now with everything else. But some of those things, but we will work them in. Some of those things include quite a while ago, the board had some discussion about the yard sale program, and I jotted down a whole bunch of notes to try to make some revisions and updates to that for the board's consideration. And Ken and I, we're going to meet on that, but just too many other real estate things have come forward, but that is on our list of things to do. The Nantucket Water Quality Improvement Options Report is out. I just need to get that scheduled before the board. And I need to work with Jeff Carlson on that. Just have not gotten to it. Same with pool discharge regulations, beach management regulations. Baxter Road long-term planning, I know is an issue that's been out there for a bit. Just another group I need to get together to get back on track with that. The strategic plan update, the board does have a retreat scheduled for October 14th, 13th. And we had a meeting yesterday to start planning for that. And municipal facility needs, a workshop, the master plan workshop. We talked a little bit about that today at the agenda meeting, and that's something I just need to get a date on and to get a couple dates out to you all so we can get that scheduled. Paid parking had to be put aside for a bit, so at some point the board should determine whether we are going to bring that forward. The Hunting Association lease status sort of remains out there, and marijuana license regulations. I know we've forgotten all about marijuana at this point, but there are some regulations that we need to adopt. And a couple of personnel things. We do have a current hiring freeze or chill, except for essential positions. We are trying to hire more, maybe not so much at this point, public health inspectors for COVID, but the educators, as we mentioned earlier. We've got collective bargaining going on for all units. I think we're going to get an update before the end of the meeting about the DEI, Diversity, Equity, and Inclusion Director position, and the assessor position, which you all know about. So that's this month's report, and I'm happy to take any questions.
Anybody? Jason?
Yeah, on the paid parking, at some point this fall or winter, will we have any data or anything to look at, even if it's really small, to help us make a decision if we're going to do something this next summer season?
Well, you mean from the license plate readers that we use this summer?
Yeah, even if it's simple as this is what worked, this is what didn't work, this is technology we used, and then what little data that we did pick up.
Yeah, I think it'll be pretty little. But yes, we can put a report like that together as to what we did this summer. I mean, we couldn't do a lot. We had to put the parking coordinator on hold. And there was an article that passed at town meeting that it's non-binding, but it does seek for the board to get a vote of town meeting before implementing paid parking. But we could put something together for a board discussion, sure.
Yeah, because we might even decide not to do where we were heading, but we want to use the technology or somewhere in the middle. And so that would be a good discussion at some point this off season.
It's probably something that will come up during our strategic planning session as well, since it was one of them.
Oh, that is another thing. I haven't gotten it together yet, but I'm trying to put together for the board's October 7th meeting a strategic plan update. So you'll have it right before the retreat. You last had one, I think, in January, and we had been planning another one, but obviously that fell apart. So some of that information, I think, Jason, that you just mentioned will be in the update, but I'll work on that.
Melissa?
Thank you, Dawn. Thank you, Libby. I just am curious, since we've got a long stretch of living with COVID in front of us, has there been any internal discussion about the need for expanding enforcement officer positions from seasonal to more permanent for right now? I'm just curious. I know you've got everyone so overloaded, and I'd hate to think that we're not prepared going into the winter.
We've talked about seasonal only at this point, which I think could get us through the winter. But you're right. It may be a discussion to have for longer period of time. Maybe year round. I think things are so uncertain going forward that we don't want to hire somebody and then have to lay them off or something like that. But I hear your point.
Yeah, I just, with the next phase coming up being the one where we get a vaccine, I mean, that really could be a bit away before we have a sense of security. And it would be nice to know that we're fully staffed and it's not a burden that's continuing to pile on to existing staff.
It may be a reallocation issue in some manner, but that we'll have to deal with. And I just I can't let the parking go by. I hope we don't get cold feet on the parking, especially if we like things like outdoor dining this summer. And if we don't want to see more yards turned into parking yards, more gardens turned into parking yards, we need to get the data and we need to, have a spine and get this sorted out. And I know it's going to be it's publicly the third rail, and it has been, but it is absolutely needed. The problems are out into the hinterlands of the downtown neighborhoods already. And so, I hope when we do our planning that we really, don't give up on it.
Jason?
Yeah, thank you for what you just said there, Matt. Just reminded me that I just wanted to ask the board on, maybe this is select board comments of when do we need to start making decisions, having discussions for next year on things like, the seating outside and what did we like. And that's, because I'm already getting calls from restaurants asking about next year. They know we don't have an answer right now, but they're planning now, with capital. And so I just want to make sure it's probably all already on our radar somewhere in the silver sheet, Dawn and Libby, but just, as much as we can know now what we'd like to do.
Yeah, that's a good idea. We should put it, I'll have to double check it.
Okay. Can we move on to select board reports and comments? Continued discussion update as to our racial equity, race relations task force and community forum. We don't have Rachel, do we?
No, I think Melissa's going to do this.
Oh, Melissa, please go ahead.
Sure thing. So September 10th, the 7-member screening work group, which representatives from Human Resources met to review 33 applicants who met the minimum qualifications of the Diversity, Equity, and Inclusion Director position. The job posting had closed on August 10th. The team is made up of, just as a reminder, myself, Rachel Day, Assistant Town Manager, Health and Human Services Director, Roberto Santamaria, the Nantucket Employee Empowerment Team representatives Osaji Doyle and Venetia Williams, FinCom Chair Denise Cronow, who also has personal experiences as a DEI director, and then our community representative is Sarah Singleton. So really great group of people. So we went through and screened applicants and chose 13 candidates to move forward. And the next step was that we asked those candidates to respond to written questions, and they're to provide those written responses to us by September 18th. There's 4 questions, and the questions were compiled from suggestions of the 7-member group, the Council for Human Services, and NEAT. They were really, the deliberation on those questions were really thoughtful. When we receive those, the group will review them and provide feedback, again, in a blind manner on who we feel needs to move forward in the process, and that's scheduled for September 22nd. Those who are determined to advance will then have phone interviews scheduled at a date to be determined. So that will be the next step. The outline of the process is available for review shortly on the Town of Nantucket website, and the page name is Promoting Racial Equity. And Rachel asked me to pass along thanks to the Human Resources Department for their organization and assistance in developing this very thorough and new process and keeping the timeline on track for hiring this position, as well as keeping it a top priority. Theodora has done a wonderful job. I'll give her a shout out. So that is our update. And as a reminder to us all, our hope is to issue the RFP with the new director at the helm of that new department.
Thank you, Melissa. I know we'll look forward to see how the interview process evolves.
Some really great applicants.
Sounds like it. Any other questions or comments from anyone? Committee reports. We set our dates for CPC for deliberations on the applications that were less than usual, but we do have some good ones in, and those will be right after Columbus Day that week. Christy?
Thank you. We had an Affordable Housing Trust Fund meeting yesterday, and we reviewed the request for proposals. So that's still open for anybody who's interested in possibly selling land or property to the town for affordable housing purposes. We also discussed the CPC application that the Affordable Housing Trust submitted. It was really amazing to see how this comes together. Affordable Housing Trust has really been built into the overarching housing organization on the island. So Habitat and Housing Nantucket and Food, Fuel and Rental, and everybody that kind of has housing initiatives kind of apply to the Affordable Housing Trust, and they submit one application. So this helps resources with CPC, and then also kind of has this one vision of how we're tackling affordable housing on Nantucket. And the other update is we talked about a housing production plan. So we've hired a firm to update that, which keeps us in line with the governor's housing choice options or certified town, and will help us just kind of plan out the next couple of years. Today we had a housing stakeholders meeting. This isn't really, I'm not on this as part of a select board, but something I just wanted to bring to select board's agenda is just really how COVID is bringing out our housing issues more, and especially in this recent surge. Just really, Tucker Holland is such a great advocate, and I just want to take some of his strength and words and push the select board that we really have to make this top of mind. And even when we're talking about something else, it has to come back to housing and racial equity and everything. It's really all tied together, and just not losing sight of that. And if Tucker doesn't mind you guys giving him a call, I think having this conversation the last couple of days, it's really motivating that we have to keep our eyes focused on how we can do the most with what we can, trying to use that $20 million in the best way possible, but really realizing that there's real consequences to not taking action. And as Tucker is saying, life or death consequences. And this is really becoming relevant during COVID, that we have to take action and create affordable housing on Nantucket. So those are all of my updates. Thank you.
Thank you. Matt?
Yeah, I just follow up with that, Christy. The other way to think about housing, when people talk about economic diversification and building businesses and everything else, my mind kind of turns out, because unless we have housing, none of that matters. And so if we want to help businesses, one way to think about it is let's figure out the housing issue. And I think it is everything. I agree with you. I just, in that regard, I shared to the board, I shared a link to a missing middle housing website. Basically, what we're missing on Nantucket, we haven't built any of these sort of small apartments we used to build. And you think about places like the hospital on Westchester Street. There's a house on the corner of Prospect and New Mill that's got 3 or 4 units in it that moved from the original Sherburne town. And these houses they're the size of a large house. They have small units in them. They house they house older people or young people starting out. They're not surrounded by a parking lot. It's not that next size. And it fits in to the landscape. It fits into the island. The row houses on Orange Street are an example of that type of building where you don't need a lot of parking. You have, 4 units in a small footprint. And I think sometimes people worry about us overbuilding and they don't want density. but we should be targeting that type of density, not the huge apartment buildings, but the missing middle. It's a great name. We should be targeting that and making, policy decisions to allow that in the right locations. And we have to take leadership and explain that to people, why it's such a good thing. The Civic League sometimes thinks, and I love those guys, but sometimes they think we can't add any more density downtown. We can't add any density in the Mid-Island. We can't add any of the wrong density. But if we put the right density in the right places, you won't even notice it. So it sort of, I went a little longer than I'd hoped, but I sent that. I hope everybody reads it. I've sent it to the planning department. I've sent it to the planning board, NPADC. I hope, it gets disseminated. It's really what we're missing, and we need to tackle it. I've given a book about it to Tucker. So, it's the direction we need to head.
Thanks. I don't want to go too far down this since this is just committee reports, but Rick Atherton has his hand up. If it's a brief comment, Rick. Can someone let Rick in?
All right, I just unmuted Dawn.
I can hear you. Go ahead.
Thank you. Just a reminder to Matt and to all of you that it seems to me that $20 million was clearly meant to be dispersed in smaller, concentrated areas than the project on Orange Street. And I'm reacting to Matt's comment. And I think that the examples he raises are probably excellent examples, and they're not the same as the project on Orange Street, which has 34 units in one concentrated area. And if you pay attention to the comments of our state representatives at the Civic League annual meeting, they were concerned about exclusionary zoning. And it seems to me the problem here is the $20 million was meant to combat that by dispersing affordable housing development. And the development under consideration right now, it seems to me, is doing just the opposite. Thank you for your time.
Again, I don't want to get into a debate about this tonight. We could put housing discussion on a future agenda because we're just under committee reports right now. But are there any other committee reports?
No one else comments.
It lets Tucker know you haven't gone away.
Yeah.
Anybody else? Okay, is there a motion to adjourn?
So moved.
Second.
Sorry, thank you. All those in favor by roll call: Melissa Murphy.
Aye.
Christy Ferrantella.
Aye.
Matt Fay.
Aye.
Jason Bridges.
Aye.
John Holgate, aye. Thank you all very much.
Thanks, everybody.
Thank you. Good night.